Hello. Welcome to the Lifestyle in Focus channel. In today's video, we'll explore a fundamental topic for anyone seeking a healthy life: preventing memory loss. We'll understand the difference between memory lapses, mild cognitive impairment, MCI, and dementia, and learn effective strategies to keep our minds sharp. Make sure to like the video, subscribe to the channel, and share it with your friends and family. Because when it comes to health, it's worth sharing. Mental health is a crucial aspect of our lives, and understanding how to take care of our brain can make a significant difference in our quality of life. Today, we'll clarify what memory lapses, mild cognitive impairment, and the different types of dementia are. At the end, I'll share recent tips for preventing memory loss. So, let's get started. Yesterday, President of the United States Joe Biden announced that he is withdrawing from the presidential re-election candidacy. What do you think led to this? Well, numerous causes, but the decision was influenced by the memory lapses that started becoming apparent since the debate with Trump at the end of June, leading to a flood of criticism from the press, with concerns about his performance, including his weak and muffled speech and his tendency to present illogical arguments or hesitate. After all, what is a memory lapse? Is it different from dementia? Today, we're not going to talk about politics, but rather clarify these issues and explain the differences between memory lapse and dementia. What are memory lapses? We've all had moments when we forgot where we put our keys or the name of someone we just met. These small slips are normal and can happen due to stress, fatigue, or distraction. They are known as memory lapses. They are common and usually not a cause for concern. However, it's important to differentiate these lapses from more serious conditions that can affect our memory. Difference between memory lapses and dementia. Dementia is a much more serious condition and is not a specific disease, but a general term for the loss of memory, language difficulties, problem-solving issues, and other mental skills that interfere with daily life. Dementia is caused by damage to neurons, the brain cells, which affects communication between them. Mild cognitive impairment, MCI. Between normal aging and dementia, we have mild cognitive impairment, MCI. People with MCI have memory, language, thinking, or judgment problems that are greater than expected for their age, but not severe enough to significantly interfere with daily life. About 12 to 18% of older adults have MCI, and it's important to monitor these signs closely as about 10 to 15% of people with MCI develop dementia each year. Common types of dementia. Alzheimer's disease. Alzheimer's disease is the most common form of dementia, accounting for about 60 to 80% of cases. It is characterized by the progressive death of neurons, leading to a continuous decline in cognitive and memory abilities. Risk factors include advanced age, family history, genetics, and lifestyle factors such as a sedentary lifestyle and poor diet. Vascular dementia. Vascular dementia is the second most common form of dementia and is caused by a series of small strokes or the narrowing of blood vessels in the brain, reducing blood flow and damaging brain tissue. Symptoms include problems with planning, reasoning, and judgment, as well as memory loss. Frontotemporal dementia. Frontotemporal dementia is caused by the progressive degeneration of the frontal and temporal lobes of the brain, areas associated with personality, behavior, and language. Symptoms may include drastic changes in personality, inappropriate social behavior, lack of empathy, and difficulties with speech and language. Early signs of dementia. The early signs of dementia can be subtle and easily attributed to normal aging. It's important to be aware of these symptoms to seek medical help early. Some common early signs include recent memory loss, forgetting recent events, names, or places, Difficulty planning or solving problems. Difficulty following plans or solving simple problems. Confusion with time or place. Getting lost in familiar places or forgetting important dates. Communication problems. Difficulty finding the right words, following, or participating in conversations. Mood or personality changes. Drastic mood changes or disinterest in activities that were previously enjoyable. Difficulty performing daily tasks. Problems performing routine tasks, such as cooking or handling money. Loss of initiative. Lack of interest in participating in social activities. Impaired judgment. Making poor decisions. Visual difficulty. Problems judging distances or perceiving contrasts. Diseases that can mimic dementia. Not all symptoms of dementia are caused by neurodegenerative diseases. Some medical conditions can mimic dementia, presenting similar symptoms but which are potentially reversible with proper treatment. These include vitamin B12 deficiency, hypothyroidism, depression, infections, metabolic disorders, medication effects, brain tumors, head trauma. Prevention of dementia. While there is no guaranteed way to prevent dementia, lifestyle changes can reduce the risk. Here are some tips based on recent research. Stay physically active. Regular exercise increases blood flow and oxygen to the brain. Adopt a healthy diet. Diets like the Mediterranean diet, rich in fruits, vegetables, whole grains, fish, and healthy fats, can benefit the brain. Keep the mind active. Activities such as reading, learning new skills, doing puzzles, and playing games that stimulate the brain. Sleep well. Quality sleep is essential for brain health and memory consolidation. Socialize. Staying socially active can help prevent depression and loneliness. Take care of your heart. Hypertension, diabetes, high cholesterol, and obesity increase the risk of dementia. Avoid smoking and alcohol. These habits are associated with a higher risk of cognitive decline. Reduce stress. Relaxation techniques like meditation and yoga can help reduce stress. Maintain a healthy environment. Reducing exposure to toxins and pollutants can contribute to brain health. Have regular UPS. Regular medical checkups help identify and manage health problems early. Recent scientific discoveries give us hope that lifestyle changes can not only reduce the risk but also reverse cognitive decline in the early stages of Alzheimer's. It's never too late to start taking care of your brain. Did you like the video? Like, share, and help others take care of their memory and health. Comment below if you have noticed any of these signs in yourself or a family member. Leave your like and subscribe to the channel. See you in the next video.